Welcome everybody, and a pleasure to introduce you to this course that will focus all the attention on globalization and health. But I call this first lecture Globalization, Trade and Health. So the reason why we will see during this lecture, but also during the next lecture, how is important the relationship between the trade and health. So let's have a look at the learning outcomes of this lecture. So first of all, we introduce the concept of globalization, what we mean for globalization in terms of the commerce, the trade, and how these affect our entire economy at the global level. Then we integrate in the concept of globalization, correlated generally to the trade, the social and physical determinants of the globalization, because the aims of this course is to assess the direct and indirect impact on healthcare in all healthcare systems. Then we describe why accelerating the flow of traded goods and services enabled by economic integration has created new sources of wealth and health for some. We describe interaction between globalization and pandemic risk, and we analyze the impact of globalization and the unequal redistribution of resources. So we will see in this lecture how the globalization is creating a positive impact, but also negative impact. What is very important, and we'll focus attention in this lecture, is the linkage between the trade and health. So first of all, let's have a look how we can define the globalization. Globalization generally refers to three distinct interrelated phenomena and dimensions. The first is the increasing cross-border flow of goods, services, money, people, technology, and ideas. So the first part, when we're talking about globalization, it means reducing the border, increasing the flow of goods and services around the globe, increasing the trade between the import and export between different countries that affect generally all the trade. In fact, we're talking about goods, services, money, but also people, technology, and ideas as well. Another phenomenon that affects the globalization is the opening of national economy and boundary to such flow. Because of course, first of all, it's not just enough to increase the market, the share of the market of one specific company to another country. It's important that there is an agreement between different countries to open this market. And then another phenomenon is the development of international institutions and rules governing this cross-border flow. So this is the three phenomena that affect the globalization. And all the above three phenomena strongly influence and are affected by national macroeconomics and social policy, regulatory, environmental, and institution. So when we're talking about globalization, we're talking about phenomena that affect not just the economic aspect of our society, but affect the people, affect the institution, the regulation and agreement between different countries. So this is something that completely changes the way how the goods and services are traded around the globe. And this, of course, affects our entire economy and also how the institutions are organized. Now let's have a look at the effect of globalization. First of all, the first impact of globalization is on individuals. So globalization affects their access to goods, their price, and the ability to travel. So first of all, you can imagine how there are several multinational companies, how they start to sell the goods around the globe, and how these organizations also affect the prices. Because when we're talking about economic of scale of this big company, of this huge company, of course, they have also, they're really effective, the prices. In some way, they have some positive effect in terms of reducing the price, reducing also several barriers in terms of selling goods between one country to another one. Another effect of the globalization is on the community. So this level encompasses the impact of globalization on local and regional organization, the business, the economy, and also affect the cultural effect of this phenomenon. You can imagine how in the last 30 years, for example, how the people start to traveling around the world. That was nothing compared to 30, 40, 50 years ago. There is a million and million of people that every day moving from one country to another one. This affect not just the economy, but also affect the community, the local community, in some way, in a positive way, because of course maybe they increase the amount of money that some people can spend traveling also in holiday, but at the same time this is have also a cultural effect and impact on the local community. Then there is the institution. So the multinational corporation, national government, and other organization are all affected by the country approach and acceptance of globalization. Globalization also affects the ability of company to grow and expand. So imagine a company such as McDonald's, Coca-Cola, Phil Morris. There are several multinational company that they increasing the market, increasing their sales, do it also to the agreement between different countries. So the globalization affect not just the economy, affect the individuals, the community, and all the institutions. We can summarize in a very easy way this phenomenon in three dimensions. First of all is the trade, the migration, the telecommunication. This is three different aspects that they interact each other. For example, the nature of the flow of physical goods, generally that they're moving from one country to another country, the migration, so the flow of people. So imagine how millions of people are moving to work in another country. For example, maybe they are employed from a multinational company that operates in several countries. So this does not just affect the flow of physical goods, but also affect the people, especially when we're talking about, for example, the oil and gas company, because they're looking for a very high-skilled employer. And then also what is very important and what completely change this phenomenon is the telecommunication. The telecommunication with the digital economy and the internet that spreads so much information around the globe that now, for example, when people can try to find a job not just in their country, they try to find a job also outside their country. This is just to have an idea how the globalization affects the entire market. But there are different types of raw material, energy, foods, affect, of course, the permanent temporary, the tourism, the business transaction, the communication, the power exchange of symbolic exchanges, the modes, for example, the freight transport modes of the trade, the passenger transport mode, vehicle, air, rail. So there are several ways how this phenomenon affect our society. We will focus, of course, the attention because this course is much more on health than in trade. But what is very important that you understand which is the relationship between the trade and health. So increasing the cross-border flow in goods, service, people and capital, whatever health related of wider relevance, will affect health through a number of ways, including, first of all, the cross-border spread of infectious disease. So as soon as millions of people that are traveling every day from one country to another one, of course, maybe traveling for a holiday, but most of the time they're traveling for working. They're traveling for visiting friends because maybe they change the country where they're working. Of course, this increasing exponentially the risk of spreading infection disease. And one development effect of the health sector is the increasing trade in services. So indeed, perhaps the main reason that the health sector has been relatively unaffected by globalization directly is because it is predominantly a services-oriented sector. So generally, the reason why we have to take in consideration the health sector is because this international global way how the goods and services are traded affect the people, but also increasing exponentially the risk of disease, the risks of the virus. We will see at the end of this lecture also the case of COVID-19, how it was spread. Maybe 50 years ago, this pandemic couldn't happen. So this is very important that you realize the relation between the trade, between this completely new way to trade the services affect the entire our society, but also how they increase the risks of pandemics, of a disease, and so on. At the same time, have also some positive effect, because globalization affects also the way how the health services can be provided, and not just inside one single country, but we can spread, we can increase also the market, for example, of vaccine. So there are also a positive effect of globalization. So we don't have to see the globalization as a negative phenomenon, but we have to take in consideration also the risk correlated to the health sector. So now let's have a look at it. In the next lecture we will focus attention more on the linkage between the trade organization, the World Trade Organization, and all the health sector. So the trade agreements too will have implication for health and health sector, whether they are bilateral linked to the World Trade Organization or involve regional trading systems. For example, imagine the European Union, the Association of Southeast Asian Nations, the Southern African Development Community, and the North American Free Trade Agreement, the NAFTA. So there are different bodies, there are different organizations that in some way regulate and they sign the agreement, because without this sort of agreement it's almost impossible that the trade can be freely and all the goods and services can be freely traded around the globe. So it's very important. Of course, this is a course on healthcare, so we will focus just less on the trading. But anyway, it's very important that you understand the correlation between especially the World Trade Organization, that is one of the most important institutions in terms of the agreement between different countries, and also because inside the World Trade, the WTO, there is also several agreements in terms of healthcare systems, in terms of goods, especially the fruits, meats that are trading to avoid and reduce the risk of disease. So there are several very strict rules that are that was developed and was agreed by the WTO. So similarly, the WTO in 1994 agreement on a trade-related aspect of intellectual property rights mandate patent protection for pharmaceuticals, which has the potential to provide a greater incentive to invent new medicine, but is also linked to the increase in the price of those new medicines and therefore reduce their accessibility, especially to the poor countries. So the WTO also, there was an agreement that was called the TRIPS that make some specific agreements on the pharmaceutical, on the vaccine, and all the correlated new medicine in terms of protocols, in terms of the patent to develop and sell this vaccine and medicine around the globe. But of course, this is affect also the prices, because as soon as the market has become global, there are some countries, especially the development country and the poor country, that most of the time they don't have access. The typical example is the HIV vaccine, the HIV treatments that are too expensive, for example, to all the African countries. Anyway, it's important that you start to understand how is important the WTO institution, organization, how they affect, and also how the development several different agreements, especially to control and also to increase the development of new vaccine, to increase the market and the share of different kind of medicine and drugs. So this is important to understand the correlation between the trade and the healthcare sector, because when we're talking about the trade, we're talking about also the trade of vaccine, we're talking about the trade of medicine, of drugs. That's the reason why all these aspects of the health are regulated inside the WTO organization. So historically, the trade and health have operated in separate policy sphere, but development such as just mentioned means, they also affect now the sector and also the increasing the interrelated relationship between different countries. We will see how there is also exposed and also the increase in some ways some tension between the goals of protecting health and promoting trades and goods. We will see in this lecture, but also in the next lecture, how is important to promote the trade, but at the same time we also, each country, they really would like to protect their borders from the risks of disease. So there is a very contradiction between these two spheres, protecting health and promoting trade goods. Because even if we would like to increase the market, we would like to reduce the barrier in terms of border, but at the same time we have to protect each country, their policy is to protect their citizens from the risk of disease. So there is this two spheres that sometimes they go in the same direction, that sometimes they create some barrier, because sometimes in several countries much more important the health protection to reduce the risks of disease and the risk of import hazard materials instead of increasing their market. So the globalization, why related to overall economic growth? Because increasing the overall economic growth could also result in increasing environmental and occupational hazard. So you can imagine how increasing the trade worldwide, how this affects also the increasing of CO2 emission in terms of millions of high freight that deliver goods and services around the globe. How also this increase the risks of hazards of selling and trading some chemical materials. So it could influence people's lifestyle worldwide. In some way they could influence in a positive way. For example, increasing the market of medicine, drugs and vaccine, but at the same time you start to realize how the globalization increasing the market, increase the environmental impact, increase also the hazard of several different raw materials that are traded around the globe. That's the reason why you are start to realize how the globalization have also health issues, problems, and also how this should be regulated through the different agreement. So we can see the globalization has economic opening in terms of reducing the barrier, the border, so the cross-border flow. So there are several different materials and services that flow outside each country. There is the international rules and the institution that try to, in some way, regulate this trade. Then we have the national economy and also the health-related sector. So the first goal of the globalization to reducing the border barrier, to increase the flow of different goods and services. But then what is very important at the national level, reducing the risk factor that could affect negatively one country, the household economy, because also the globalization affect the price of several goods around the globe, and the health services. So we will focus attention. This is a very an easy way to understand the correlation with this slide, the correlation between the trade and how we can in some way reduce the risks of the health in terms of hazardous material, in terms of controlling the spread of virus and any sort of materials and pollution that can affect negatively one national health systems.